Hi, I'm Jen. I'm one of the labor nurses here at Quinte Healthcare. Quinte Healthcare and Hastings Prince Edward Public Health work together to ensure you have the healthiest pregnancy and baby possible. Today, I'm going to take you on a tour of our hospital and maternal child floor. When you come to have your baby with us, the main entrance is open throughout the daytime hours from 6 a.m. to 9 p.m. If you come after 9 p.m. at night, we ask you to use the emergency room entrance. Every other door is locked at this time of day. Please know that you don't have to stop at the patient triage desk that's found in their department. Come straight to Quinte 7. You'll find signs on the wall directing you to the Quinte elevators. When you arrive at our floor, the first person you'll meet is our clerk. She'll want to see your health card and have a brief description about why you've come to see us. Once you've been registered, our clerk will show you to the waiting room. And when there's a nurse available, she'll show you to the obstetrical assessment clinic. This is the obstetrical assessment unit, also known as the OAC. Once you've reached 20 weeks gestation, you can come directly to Quinte 7 for any concerns specifically related to your pregnancy. In the OAC, we also conduct non-stress tests, if ordered by your doctor, as well as identifying when you are in labor. In the OAC, the nurse will monitor your baby using a Doptone or an external fetal monitor. During your time in the OAC, we encourage you to have a support person with you, but please be aware that only one person is allowed at the bedside to promote privacy for you and the other patients. There is a waiting room available for any additional people who may have joined you. Once you've been assessed in the OAC and it's determined you're in labor, you'll be taken to one of our 3 labor rooms across the hall. Your nurse will be one-on-one with you throughout your labor and birth. When you get close to delivery, there'll also be a dedicated nurse for the care of your newborn. Your doctor will be in and out throughout your labor and will come for delivery. If you're under the care of a midwife, they can tell you more about what that will look like. Our visiting policy here at Belleville Hospital is to have 2 people at the bedside. This can be adjusted based on your needs through a conversation with your nurse and care team. There's an additional waiting room that has space for your other family members if needed. In both the OAC and the labor room, we'll be monitoring your baby very closely. This is done through either the use of a Doptone that lets us hear your baby's heartbeat, or through the use of an external fetal monitor that provides a tracing of your baby's heartbeat on paper. The use of these tools will depend on whether or not you have any risk factors associated with your labor. These are many of the comfort measure tools we have here at Quinte Healthcare. The first one is the birthing ball. Many women like this piece to bounce up and down during their contractions as a distraction measure. Another one women often use to sit on is the peanut. This comes in various sizes. The large peanut is often used as a bench-style seating. It's nice for rocking forward and back for mobility in your hips. The smaller peanut is used between your knees when you're laying in bed, of course on your side. It helps open up the pelvis and provide better alignment for baby to come in. Another tool we have is the birthing stool. The stool can be used in various different ways. Some women will kneel and rock forward and back with the birthing stool. It can be used in the shower for comfort under warm water, and it's rated to support 2 people sitting on it if your partner wants to provide massage or support during your contractions. Our beds are adjustable. They can be flat, we can elevate the head of the bed, or we can lower the feet and elevate the head of the bed to turn it into a chair position. Many women find that comfortable, and we can also add on a bar to make it into a modified squatting position. In addition to the comfort measures we've talked about, we do offer a few options for pain relief. The first one is nitrous oxide. This is a gas by inhalation. It can make you a little bit drowsy, maybe sleepy, but doesn't affect your baby. The nice thing about this gas is that it wears off quickly. It encourages you to do deep breathing through your contractions and helps you cope better with the pain of labor. Another option is morphine. This is used very cautiously in our patients because it can impact your baby. We ensure that it's administered early in your labor to prevent any type of problems with the newborn once they're born. If we're concerned that your baby may have some effects of morphine, we make sure that we have a team of nurses and doctors available to support them. We do have an epidural option. Anesthesia does work in other areas of our hospital though. You may not get an epidural as soon as you request it. The nice thing about epidurals is it blocks perception of pain, but you'll continue to feel touch and pressure. Know that your nurse will be by your side for the duration of your labor and can support you until they are able to come. Our routine practice is to place baby skin to skin immediately at delivery. We also delay cord clamping by a minimum of 30 seconds to promote blood return to your baby and help support their iron stores for the first 6 months of their life. We aim to have an hour of uninterrupted skin to skin. This time spent skin to skin helps stabilize your baby's heart rate, respiratory rate, and temperature. It also helps support the early initiation of breastfeeding. This time skin to skin also helps stabilize your baby's blood sugar if they're at risk of hypoglycemia or low blood sugar. During this time skin to skin, the nurse will be completing various physical assessments on your newborn, and we'll talk to you about the administration of erythromycin eye ointment and vitamin K. Erythromycin eye ointment is mandated by the province of Ontario and is administered over the eye. This is to prevent any type of infection that they could contract during the delivery. Vitamin K is administered by injection into the thigh and helps promote blood clotting since the babies don't have enough in their system when they're born. The length of time you spend in the delivery room will depend on the length of your labor. This looks different for everybody and will depend on your progress. Your care team will monitor you closely. Once you've had your delivery, you'll spend at least 1 hour in this room during your recovery stage, at which point you'll be moved to your postpartum room. In the event you need a cesarean section, we have 2 operating rooms on our floor. You'll also spend your recovery on our unit. We do our very best to provide skin to skin directly in the OR. Your partner is also able to do this. Know that your partner and baby will stay with you for the duration of your surgery. In the rare event that you need to be put to sleep for your cesarean section, your partner will have to wait in another room. After you have your baby, you will be moved to a postpartum room. We have 3 private rooms available on a first-come, first-served basis. We have 1 ward room and 5 semi-private rooms. If you have a vaginal delivery, you will be admitted until the baby is at least 24 hours old, and if you have a cesarean section, it's common to stay for 2 days. This is different with each family and changes based on your needs. In the rare event your baby needs to be admitted to the special care nursery, this is where your journey will start. When you call down to the nursery, you'll pick up the phone and a nursery nurse will be on the other end. Let them know who you are and what baby you're there to see, and they'll open the doors for you. If your baby's admitted to the special care nursery, they'll be cared for by a team of doctors, nurses, or respiratory therapists. The length of time your baby spends in here is dependent on the reason they're admitted. You'll have the support of the nurses and staff to do skin to skin and breastfeed while you're in here. Please ask them any questions you might have. They're happy to share with you. Do know that only 2 visitors are allowed at your baby's bedside at any given time. Once your baby's 24 hours old, your nurse will conduct 3 screening tests. 2 of these tests require a small blood sample that's collected through the prick of the heel. The first one is the Newborn Screening of Ontario. This test identifies the risk of having 26 treatable diseases that, if caught early, can prevent serious illness. The second one is a test for jaundice or hyperbilirubinemia. The blood test is to identify a high level of bilirubin, and if there are concerns about this, you may have to stay longer for monitoring or treatment. The third screening test is the critical congenital heart disease screening, or CCHD. This test is done using an oximeter, which is a light sensor on one hand and one foot. All of these tests can be conducted when your baby is skin to skin or breastfeeding if you'd like. At some point after 12 hours of life, a screener will come from the infant hearing program to do your baby's first hearing test. If the screener is unavailable or it's a weekend, you'll get a phone call booking your baby's test. A common question we get is when your baby will have their first bath. Once your nurse feels that your baby's vital signs and temperature are stable, she'll set up to do a demonstration. This is so that you can practice the task before you go home. This is the nourishment room. You'll find it across from room 712. In here you'll find an ice and water machine, and although we have small cups available, I would encourage you to bring a large refillable cup or water bottle for use during your stay. You'll also find a Keurig coffee maker, a toaster, and a microwave. We do have a fridge here in Quinte 7. You may want to consider bringing in some specific food items you'd like for yourself, but be sure to ask for a label to put your name and date on the food when it's in there. We do have some items available for patient use, but that can be limited at times. In this room we also have a freezer, and it's stocked with pads that have been frozen with water and witch hazel. These are helpful for healing and for comfort after your delivery. Please feel free to take them as you feel you need them. When you're ready to return home, your nurse will spend time with you reviewing your postpartum booklet. They will review several important teaching points, identify resources you can access in the community, and explain how the feeding tracker is used for your baby's follow-up appointments. A public health nurse will connect with you before your discharge.
Hi, my name is Erin Kenny. I'm a public health nurse and a lactation consultant with Hastings Prince Edward Public Health, the Healthy Babies, Healthy Children program. I'm available on Quinte 7 Monday to Friday to help you with your new baby. When you do come in to have your baby with us, please ensure you sign a consent form that looks like this. Your nurse that's doing your admission will ask you if you'd like to see the public health nurse. If I am on the unit Monday to Friday, I will gladly see you and your new baby. If I'm not on the unit or you're discharged over the weekend, we will ensure that you get followed from a public health nurse once you go home. If you have any questions about your baby or you need any help with breastfeeding. When you see me, I will go through some questions with you, answer any questions or concerns you have about yourself or your new baby. And if you're having any breastfeeding issues, I will provide you with a one-to-one breastfeeding consultation. I look forward to meeting you and your new baby.
Before you leave, the nurses will want to see that you have a car seat and understand how to use it. You will also be provided with the information to register your newborn with the province of Ontario and obtain a health card for them. Thanks for coming on this tour with me. We look forward to meeting you when you come back to see us to have your baby.